Hello dear friends, how are you doing today? I hope you are doing well. Welcome to a new question about dermatology. A 26-year-old lady presents to you distressed due to the presence of a rash over her thorax and abdomen for the last 3 weeks. On examination, you note numerous teardrop lesions on her body. She has no known past medical history and denies exposure to any new irritants. She states that she is going to be married in 2 weeks and wants to know if there is anything that can be done to hasten the disappearance of her rash. Which therapy could this lady be commenced on? A. Photochemotherapy, A. or PUVA, B. Oral prednisolone, C. Dermawate, D. Ultraviolet B. Phototherapy, and E. Methotrexate. Here we have a 26-year-old lady presents to your distress due to the presence of a rash of a thorax and abdomen for last 3 weeks. On examination, we can see numerous teardrop lesions on her body. Numerous teardrop lesions mean that the diagnosis can be Guttate Psoriasis. The patient has no any significant past medical history and denies exposure to any new irritants. This question wants to say that the diagnosis is not contact dermatitis. She states that she's going to be married in 2 weeks and wants to know if there is anything that can be done to hasten the disappearance of her rash. This question is talking about the acute management of guttate psoriasis, and their best choice for managing their acute guttate psoriasis can be ultraviolet B phototherapy. Here we are going to explain it. Explanation: this patient has a classic description of guttate psoriasis. Whilst guttate psoriasis will usually self-resolve, ultraviolet B phototherapy has been known to accelerate resolution. The other treatments have no role in their acute management of guttate psoriasis. The other treatment here is include photochemotherapy, A or PUVA, oral prednisolone, ultraviolet dermawate, and methotrexate. They have very, especially oral prednisolone or corticosteroids have a good impact on the management of psoriasis, but in acute management, the best choice is ultraviolet B phototherapy. Narrowband UVB and BUVB is a first line for widespread guttate psoriasis if not resolving spontaneously, and it is highly effective and often leading to remission within weeks. Here we can see different types of devices for phototherapy for patients with skin disease, especially psoriasis. Okay, this was a short explanation about the acute management of guttate psoriasis. We talked about different types of psoriasis presentation and management in our YouTube videos. For more information, you can watch them. Thank you for your attention.